Okay.
Yeah, just so that, okay,
And so my name is Lorraine Carlson, and I am a member of the steering committee for PALS. We have other steering committee members here this morning, Juan Gutierrez and of course, Ruth Deborah, and our own founder, Richard Bass, is here, and we are glad, and anyone else, and also former steering committee members, Rob Weiser, and we have some wonderful guest speakers today, and also Tom Bettinger, who is a former steering committee member. I'm here to tell you just a little bit about PALS and then to introduce our speakers. So let me go ahead into that. As many of you already know, PALS was founded by Richard back in 2013, and we are today an unincorporated nonprofit association. What a big mouthful, based here in Palm Springs. PALS, for 7 years, going into 8 years, now almost 9 years, I guess, provides no-cost educational programs, tools, and resources to help LGBTQ plus adults and friends and allies to effectively plan ahead before a health or other life-altering situation arises. Our motto at PALS is, it's never too soon to plan ahead. Anyone who provides their name and email address when they sign up for a PALS seminar or a workshop or a cafe or one of our special events, or who joins our PALS Facebook groups, we consider you a PAL. You're a member of a community of LGBTQ people and friends who care about and look out for each other. Today's program, When Dignity Doesn't Equal Suffering, the title itself was hopefully to entice you to come and learn about California's End of Life Act in a way that focuses on the emotional and more personal side of it. And we have actually three wonderful speakers here today to help us walk us through. Leslie Chinchilla, who is the California campaign organizer for Compassion and Choices. She's based in LA County and has been with the organization for a little more than a year now. Currently, she and the rest of the California team are working to pass legislation to keep and improve the California End of Life Act. And I know she's gonna tell us a little bit about that effort. Tom Bettinger, well, many of you should recognize Tom from his previous PALS activities and events, including Deaf Cafes. Has been a fantastic member of the PALS steering committee for 4 years, and until he basically needed to leave us with PALS to deal with, which is really wonderful. Along with his husband, Bill, Tom moved to Palm Springs from Pennsylvania in 2010 after a 32-year career with the federal government. He has more than 20 years experience as a hospice volunteer, including the past year and a half with family hospice care here in Palm Springs. And most importantly, he's trained as an end-of-life doula. So we're going to hear from him about what that's about and his work with that. So without further ado, we're going to keep letting people in as we need to. I'm going to ask everyone to make it easier to see our speakers today. If you want to change your orientation from seeing the whole gallery to speaker, then you'll be able to see the person speaking at this time. And I'm going to ask everybody, if you haven't already, to mute yourself, so that way there's no interruptions. You all know where the bathrooms are. If you need a snack, have one handy. And let me turn it over to Leslie.
Thank you so much, Lorraine, and thanks everyone for jumping on this call. I'm just going to quickly go over the California End of Life Option Act and then turn it over to one of our storytellers, Julie Stroud. So just to give a brief overview of the California End of Life Option Act, it was signed in 2015 by then California Governor Jerry Brown, and it went into effect in 2016. The End of Life Option Act authorizes the practice of medical aid in dying, which allows a terminally ill, mentally capable adult with a prognosis of 6 months or less to live to request from their doctor a prescription for medication that the patient can decide to ingest to die peacefully if their suffering becomes unbearable. So I'm going to go over a few of the eligibility requirements, the core requirements, which is that the person must be a California resident. They must be 18 years or older. They must be terminally ill with a prognosis of 6 months or less to live. They must be capable of making medical decisions, and they must have the ability to self-ingest. And just something important to note is that if the patient can no longer swallow, they can use a feeding tube or an anal catheter as long as the person is still able to push the plunger themselves. So those are the core requirements. Now, those are the requirements, but how does this process actually go? So the main thing is to talk to your doctor. Lorraine mentioned, being prepared. So the most important thing is to talk to your doctor right now and just make sure that if this is something that, you think that you would want to use, it's important to talk to your doctor and make sure that they support you in all your decisions. So just talk to them as soon as possible and ask them, if I were to want to take part in the End of Life Option Act, would you support me? So once you find a doctor that is supportive, and let's say you start this process, so what are the next steps? So once you find a doctor, there are a few more steps, which is if your doctor is supportive, you do have to find a second doctor to confirm your prognosis of 6 months or less to live. So, and then after that, you have to make a second oral request to your main doctor, which has to be separated by a minimum of 15 days. And then number 4, you need to complete a written request, which can be submitted to your main doctor during the 15 days. So these are the main steps, and generally it takes about 7 to 10 days to fill the prescription. It just depends on, sometimes it could take longer, shorter, it just depends. So those are the main steps, the main requirements. But like Lorraine mentioned, we are trying to introduce SB 380 to keep and improve the End of Life Option Act. And that's because one of the main things that we've seen is, interestingly enough, actually 1/3 of patients that get the prescription don't actually use it. But we have found that there's barriers still to access this law. And 1/3 of patients don't make it through the 15-day waiting period. So that's why we introduced SB 380, which would reduce the 15-day waiting period to 48 hours. Other key improvements would remove the sunset provision, because the End of Life Option Act is actually set to expire in 2026. So it would remove that provision and make it a permanent law. And it would also make everything more transparent. So right now, if you go to a healthcare system that isn't supportive, they're not required to give you all that information. So we just want to make sure that there's transparency, that even if you're at a healthcare system or with a doctor that won't support you, they still give you all the information necessary to find a doctor that will support you if you want to use this law. And another key improvement is that we want to remove the 48-hour attestation form. So as it stands, 48 hours before you're set to ingest some aid in dying, you have to confirm it with that attestation form. And we've just found that it really stigmatizes this, and you've already gone through the process and it's still unnecessary paperwork. So we want to make sure that we get rid of that. So right now we're actually here, it's set to be heard next week in the Appropriations Committee. And we're working really hard behind the scenes to make sure that it passes and we are able to make this law permanent. So those are a few of the nuts and bolts of the End of Life Option Act. But just to give it, a more personal perspective of this law and why it's important, I want to turn it over to one of our storytellers. So her name is Julie Stroud. She is really amazing, a great storyteller for us. Her father got medical aid in dying, but he actually did not end up using his prescription. But his prescription did provide him peace of mind in his last days. And now I'm going to turn it over to Julie Stroud, who will share his story.
Thank you, Leslie. And hi, everybody. Thank you for having me. It's such a pleasure. I've got the screen on gallery view so I can see all of you. It's such a pleasure to get to talk to you today about my favorite person on the planet, my dad. I don't love doing screen sharing because I think it makes it kind of removed. So I'll just hold up a picture of my dad and hope that you can see him. This is my dad, Barry Stroud. He was a professor of philosophy at UC Berkeley for over 55 years. He was a traveler, a reader, a cinephile, a runner. He was incredibly healthy and active and fit, and he was my best friend. In May of 2019, virtually out of nowhere, my dad started having trouble walking with an even gait. And he was a little bit more forgetful than was characteristic of him. So I encouraged him to go see his doctor, and his doctor did some tests and watched my dad walk across the room with his sort of limp that he was having. And the doctor told us on that first appointment that he thought something neurological might be wrong with my dad. So he ordered some tests, and scans revealed that my dad had glioblastoma multiforme, which is the deadliest and most aggressive form of brain cancer. John McCain had it, Ted Kennedy had it, Beau Biden had it. So it's extremely deadly and lethal. And they found the tumor, my dad's tumor, they found it at a very late stage, typical of my dad. He was walking around with this huge tumor and nobody knew it. They found it at a very, very late stage, and they recommended that he forego treatment, which would be brain surgery, chemotherapy, and radiation. And they felt like the treatment would do more harm than good. And they recommended that he enter home hospice. They gave us a prognosis of 2 months, give or take. They told us that his disease progression was pretty unpredictable, but that we could anticipate him experiencing excruciating headaches, seizures, paralysis of the left side of his body, losing the ability to swallow, and most important for my philosopher father, losing the ability to think. My dad said on that first day of his diagnosis, "I have no interest in the longevity of my life, independent of the quality of that life." And so he chose to enter home hospice. On the first conversation with the hospice nurse, he asked about California's medical aid in dying. It took a little over a month for my dad to go through the process of getting the medication for aid in dying. And you can imagine that that was an extremely anxious month because he'd only been given 2 months to live. And he was worried every day about what changes were coming, whether he would still be compos mentis when the medication arrived, whether he would still be able to ingest it. His condition was deteriorating daily, and we didn't know what tomorrow was going to bring. So he worried anxiously and actively every day about how it was going to go. That's why it's so important that SB 380 is shortening that waiting period from 15 days to just 48 hours. Ever the author and lecturer, my dad used his time to work on a statement that he planned to make when he took the medication. He worked on it for weeks and then finally told us he was ready to tell us what it is. And it was, "I am taking this medication to avoid a manner of living that is unacceptable for a meaningful human life." This statement became invaluable to us because it was our shared language based on his values. We talked about what a meaningful human life meant to him. We explored what he felt he needed to complete before taking the medication. We planned who would be in the room with him and what music he would want playing. It really gave him an opportunity to, in a way, design his death. As his cancer progressed and his condition deteriorated, he endured more and more unwelcome effects of his illness. We got to ask him daily, whether his condition was unacceptable yet. Ultimately, as Leslie shared, my dad did not ingest the aid in dying medication. He didn't experience excruciating headaches or seizures, nausea, pain, paralysis. He began to sleep more and more. He slipped into a coma for less than a day, and he died on August 9th, just 10 weeks after his diagnosis. Even though he didn't take the medication, I realize now that it actually started working the minute it entered his home. It had the desired effect. At the most agonizing time in all of our lives, the medication and the option to take it brought us comfort. The presence of the medication in his home and the option to take it were something that we talked with Dad about every single day. It gave him peace of mind. It alleviated his fear and anxiety about the pain and suffering he would be forced to endure without it. At a time when he was losing power and control over everything, the medication gave my dad power and control over his most precious resource, his life, a life he loved. He told us that the train was coming down the tracks. We could all see it. We all knew it was coming. And the medication gave our family the power to remove him from the tracks in his own time and on his own terms. So that's our experience with California's End of Life Option Act. Thank you for giving me the opportunity to share it. I will just say that it turns out that 30% of people who receive aid in dying medication in California don't ultimately take it. So it does have still a real palliative effect for patients and families, even if they don't utilize the medication.
So, Julie, that was so wonderful. And as you share the statement that your dad, that statement that he said, I would love to hear it again, just so that we all hear it again, because we have some people that have joined us since you started speaking. And truthfully, for those of you who just joined us, we are talking about the emotional side of using California's End of Life Act from personal experience. And before we move to Tom, Julie, could you repeat your dad's statement for all of us so we can just hear it one more time? It was so meaningful.
I would love to. Thank you. His statement was, I am taking this medication to avoid a manner of living that is unacceptable for a meaningful human life.
Thank you. Thank you. And for anyone, I forgot to say this before, if you've got questions, please put them in the chat and we will gather them all together towards the end and be able to go through each one in an organized fashion. Thank you, Julie. That was wonderful. Tom, would you like to share with us?
Sure. It's welcome to be back at the PALS event. As you know, as already expressed, medical aid in dying isn't a simple process, and neither are the emotional aspects that are associated with it. Each case and situation is different, and that's why stories are so incredibly important and in raising awareness about the topic. And I want to thank Julie for her poignant view from a family member. And she hit on a couple things that I hope also to make. One is the importance of having hospice involved. Hospice it's not a legal requirement, but hospice is incredibly important in this process. And my frame of reference is different from Julie's. I haven't had a family member who has exercised this option, but again, mine comes from a hospice volunteer perspective, and as Lorraine mentioned, my training is an end-of-life doula, and that may be a new term for folks. I don't want to get too off on it, but it's a non-medically trained person who provides holistic support to the dying and their loved ones. And it can be practical things like help with advanced directives, psychosocial support, raising awareness, that kind of stuff. And I think PALS will be having a death cafe on that topic later this month. But anyway, I'm going to briefly discuss two individuals, each of whom made a different choice. And again, you'll hear mention of hospice in each of them. And you'll also hear something that we consistently hear from PALS, and that is the importance of planning, 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 and discussing, discussing, discussing. Those two elements are critical to anybody who's interested in this process. So first of all, it's easy to see why the emotional considerations can get complex. If you look at things as a series of concentric circles, with the center one being the dying person, and then the next circle being his or her maybe immediate family or loved ones, maybe a few very close friends. Each individual in whatever circle you're in has his or her own beliefs, values, desires, goals. And these obviously can sometimes constrict. Beyond the immediate family and friends, you have, further removed relatives and friends, and it goes out and out. And then you have the structural things in society, religion, the government rules, those and laws, those kinds of stuff. So the more interaction there is among those things, the more potential for conflict. And there's also, the emotional aspects while making a decision, while actually following through with the decision, and then after the decision. So the emotional impact can be quite significant. And regardless of what situation or what circle you might be in any given situation, to me, it's essential to be non-judgmental and kind. That's kind of a precept of doula work. Even if you don't agree, you accept the patient as where they're at. I mean, from a doula perspective. And sometimes just listening might be enough. I mean, and I think Julie mentioned about the palliative nature of just having the drugs in the house for her father. Sometimes just listening can be palliative in and of itself. So if you're in one of those circles where you're a medical provider, a pharmacist, a hospice volunteer or worker or a doula, and you can't support the person, my personal view of ethics is that you should recuse yourself, bow out, and help point the person in the right direction to somebody who can be supportive. So now my two examples. The first one, and each of these has a different outcome. The first one was I was assigned to a hospice patient as his volunteer. And over a relatively short period, we became relatively close. And he told me that after a few weeks, he told me he was considering the End of Life Options Act, although he called it the Help You Die Law, which I found kind of amusing. But I don't think he had mentioned it to anyone else. So I passed the information along to hospice so that they could help educate him on what his options were and the procedures that had to be followed. And now I will caveat this with not all hospices are supportive for whatever reasons, be it if they're religiously affiliated, they may not be, or certain facilities may not be. Compassion and Care can help with the identification of hospices in the local area that might be supportive. And at any rate, as time went on, we discussed this. If he brought it up, I didn't bring it up to him, but he brought it up several times, and eventually he selected a date. He selected a Thursday morning at 9 a.m. and he asked me if I would be there, which is really a profound thing. I've been at a number of deaths, but when somebody asks you if you will be there, that's really an honor and a privilege to me. So it was going to be at 9 a.m. in the morning. And I don't know my own emotions that morning when I woke up, but I can say there was an emotional element to me because I felt what I would call a heightened awareness. My shower felt different. My breakfast felt different. Everything felt different. I was more aware of everything going around me because I knew it was going to be a profound day. About 8 o'clock, a few minutes before I would have left to go to his home, I get a call from his hospice nurse, and he had decided not to do it. And that reinforces the whole notion of agency, that it's the person's decision. He and she can change their mind at any point, up until after they start ingesting it. It's a little late then. But, why did he change his mind? It's not that he was afraid of dying. It's not that there was all of a sudden a miraculous cure that took away all his discomfort and his pain. He had breakthrough cancer that was, despite the hospice meds, they could keep him relatively pain-free, but it was very, very uncomfortable all the time. But the reason he decided not to, he had a son who was overseas in the military, and hospice worked with the appropriate agencies. And this again is something that I personally wouldn't know how to do, but hospice interceded. And his son was granted 5 days emergency leave home. His son got home on that Monday. He had planned to do this on Thursday, and his son had to leave on Friday. But the issue with him was his swallowing was becoming so difficult that, and he was advised of this, that if he didn't do it Thursday, he may not be able to do it. And I as Leslie mentioned, there's alternatives, but I mean, he was already so debilitated that those likely wouldn't have been feasible either. So imagine how emotionally wrenching to have a son that you really, really love and were proud of home. And he made what had to be a really difficult emotional decision not to take the meds and not to relieve his discomfort as he had planned, to get the few extra hours with his son. I mean, it was just incredible to me what he must have felt like and how tough that decision must have been. Or maybe it wasn't a tough decision. Maybe it was just, my son is the most important thing in my life. And so I don't know. At that point, I didn't get to talk with him. But true to form, as predicted, the next day, after his son left, his swallowing had deteriorated to the point where he could no longer ingest the meds. So he did pass 3 or 4 days after his son's departure. So the second situation or person that I wanted to talk to was a good friend of mine, and he asked me to be part of his support network because he knew that I'd been trained as a doula, and he also had a shared interest in doula work. So, I jumped at the chance because he was a friend, and he had a support team the last few months of his life, and we met every week on Tuesday at Zoom. So of course with COVID, the only really ways to interact were Zoom, and he didn't really like using the phone much, so it was Zoom and email. So I kind of had a sense that things were going to go quicker than he anticipated. So I tried to encourage him to get in hospice much earlier than he actually did. But nonetheless, he had these plans that modified over time, and then he started considering, just again, for the peace of mind that it provides, he started considering, medical aid in dying. And it was kind of a twist, because he actually, through his healthcare provider, he coordinated everything, went through the whole process that Leslie described, and had the meds compounded. These meds do have to be compounded. It's not just regular things that you get in a pharmacy, a regular pharmacy. So he had this, and he had it all delivered in his home. And at that point, he joined hospice, which was kind of different than how it usually is. So it wasn't too many weeks later that my cat's bothering me, sorry. It wasn't too many weeks later that he surprised us. Now, we were all his support team. There were like 6 or 7 of us spread throughout the country, actually. He surprised us one Tuesday by saying, I've decided that Thursday is the day that I'm going to do this. 2 days later, which was certainly his right to do. But his power of attorney was out of the country on vacation. He hadn't coordinated a date or time with hospice. He hadn't made funeral arrangements. That's something I had been sort of, working with him on. But at any rate, we did what we could to, make sure his last few days were went according to what he desired. So that Thursday morning, 2 hospice reps and about 3 or 4 other friends and I all showed up at his home. As you might imagine, sometimes these sorts of situations can be pretty emotionally impactful on everybody involved. And I'm not saying they weren't, but sometimes the emotion's really raw. Sometimes it's people are straightforward and they're very stoic, just sort of almost let's get it over with. This was neither of those. One thing that a doula, and you don't have to be a doula to do this, anybody can do it, but is to, as Julie was describing, talk with the person about what do you want your final hours and minutes to be like. So we kind of followed through with the plans that my friend and I had talked about. We opened his windows so he could see the sunshine, let the fresh air in. We had his dog sitting around with him. We played a few songs that he had said were among his favorites. Somebody read some poems, and we just chatted. It wasn't, I don't want to say it was celebratory, because it certainly wasn't that, but it wasn't morose. It was kind of almost like a little party. And I mean, that may sound odd, but it was all kind of how he would have wanted it. So about an hour before you take the actual final medication, there's a couple drugs that you take, kind of anxiety kind of things, and help your stomach. So, he was watching the clock and he said, well, I believe it's time to take those. And so he took the first things, and we just continued bantering about. He was joking with the RN who was taking his vital signs, because he wanted to guess to see how close how close he could get to them. The day before he had guessed it accurately. So he guessed the same thing this morning, and whether or not the nurse was just playing along, the nurse said, oh, by golly, you're really skilled at this, because, whoops, I just want to pop something off my screen. A friend texted from New York, and, just everyday kind of normal things. About half an hour before he was to take, a half an hour later, and a half an hour before he was to take the final drugs, he paused and he looked up at all of us and he said, half an hour to live. And it was kind of very, not chilling, but it was very sobering. But then he said, but I'm fine with that. So we went back to in the same vein that we had been. As the time got closer, he said, I want you all to tell my friends I love them, because he knew that, the designated hour had been approaching. One of the drugs that is taken in the final concoction, if you will, is something that impacts your heart, and it has a very, very bitter taste. So generally it's recommended that you mix the compound, including apple juice or something, sort of to break that bitter flavor. So I had taken the real little cans of apple juice, and I took enough for everybody there. And I had told Jim, and he agreed that we would all toast him. And when he took his first sip, we would all take a sip. And that's kind of what we did. In this case, hospice did not want to actually mix medications, and that's up to hospice. So they just instructed me how to do it, which wasn't all that hard. But anyway, I mixed the apple juice in. He asked if he could have a little alcohol, and sometimes that helps speed along if it's, so he wanted some kind of mango liquor. We went through his entire liquor thing and couldn't find it. So he gave us an alternate. So we had this cocktail. I took it into him and I said, I set it down so he could look to see how much it was. It's only about 4 ounces. And I made a toast to him, and I just basically, I don't even know what I said other than, that I said, and we all love you. And it's time for everybody's first sip. So he took a sip of his cocktail and we all took a sip of applesauce. And true to form, he kept his humor to the very end. And like I said, it is bitter, even with the apple juice, I guess. And he just made this horrendous face and grimace. And then he said, well, that's an acquired taste, which of course we all broke up. I mean, it was so amusing. And it's like the memory that I will have of him, so, you know, doing that after he took his initial sip. So at any rate, you know, we proceeded, he took another sip and we all took another sip with him. And then afterwards, it progressed as, it progressed sort of as a normal, I lost my screen. It progressed as a normal textbook kind of case. He went into a deep coma-like sleep within 2 or 3 minutes, and his breathing slowly stopped. You know, I encouraged the folks around that everything that was happening was normal. I told them to still talk to me, could still hear them. And then after he passed, which was about an hour or so later, give or take a few minutes, you know, I said, we don't need to rush. We can just stay here and just be with him. So that's kind of what we did. It was kind of exactly what he wanted. I don't want to imply that it was a real happy, joyous kind of event or everybody was super upbeat. I mean, that wasn't it. You know, ultimately it was still a death and his loss was felt and is still being felt. But with at least having some of the right types of conversations, again, you know, after he took the first things that, you know, I was saying things like, now, what was your father's name and how did he spell that? You know, so that we'd have the information for the obituary, because Tuesday he had said maybe he'd get around to writing his obituary on Wednesday. And of course that didn't happen. So, but it was kind of, you know, everything worked out. So we did have at least some of the right kinds of conversations, like PALS is always encouraging us to do. And he had become educated about the process, but he died just as he hoped and planned. And I guess I'd say, does it really get any better than that? And I did see in the chat a question about cost. I'll just mention that at one point several years ago, some of the drugs had gotten prohibitively expensive, but at this point, I've seen 2 recent things, both in California and both in Compassion and Choices. One is it's about $750, give or take, and another one the other day, a webinar I was on said $350 to $650. So again, it's, you know, Medicare doesn't cover it because the federal government won't allow any coverage to be done. But it isn't as unreasonable as it had been several years ago. So I guess that's it. And I'll just see if anybody has anything to add, or if they want to add or make any other comments or questions.
Thank you, Tom. That was really, really quite good. And also just such a wonderful experience you had. I mean, wonderful is in a sense that it's all encompassing. It's all the emotions you felt. Interesting how you're feeling about it today. You know, when you're in the middle of it, that's one thing, but now as you've had time to think about it, anything you want to tell us about that?
Well, yeah, actually, several days after that, I helped clean out his house and his garage. He had a lot of stuff. So, you know, and he had said those on his support team, if they wanted a little thing. So I took a wind chime and that kind of stuff. And we sort of stayed in touch, his little support team. He called us the A team. We sort of stayed in touch. And I had never met some of these people. There were only 2 other A team members actually there, and they were people I had never met before. And we had a great bonding experience. The 3 of us from the A team that were there, even though we had never met before. And Pinky. And you know, it's something that we said it's a piece of each of us now, something that bonds us all. But just this morning, one of them who lives in California, who was there, he had taken this, I don't know what a huge stone sculpture and to send to another A team member who lives in New York City. And just this morning, he sent a picture of where the guy put this in his garden out on some West Plains or someplace in New York. And I mean, but it's just a memory now. You know, it's like we're sharing all these different things. And so I think we're all, you know, again, it's a loss, but I think we're all pleased to have been part of it with him. And it's a positive thing because we were involved with him, if that makes any sense. Had he just passed away and I not been involved, I mean, it's a different level of emotion, if that makes any sense at all. So.
Yeah. Wondering about the same thing, Julie, with your experience. Obviously, your dad ultimately did not have to take the drugs, but how are you experiencing that? And especially as a spokesperson or sharing your story, storyteller for Compassionate Choices, how do you find retelling that story? How is that for you now? How many years later since that happened?
Yeah, thank you for asking. It's really powerful to get to share the story of my dad's grappling with medical aid and dying. And you know, he was a philosopher, so he really thought about it and he really understood the complexities of the decision that he was making to get the medication and then to try to decide to use it. It's interesting to tell the story as a storyteller because I tell it in broad strokes. Some of the things I don't talk about very often are the complexities of being a caregiver for someone who's considering that option, and what it means to me to support my dad in ending his life before glioblastoma ends his life. You know, my own thoughts that I went through about I'm killing my dad and all that stuff. I mean, there's a lot of moral and spiritual reckoning, I think, that people do when they encounter the process of medical aid and dying. And what's helped me with that is just to fully understand that glioblastoma killed my dad. And if he chose to take himself off the tracks earlier than the disease would, it would still be glioblastoma that would be listed on his death certificate. So just to really get that, you know, he was a terminally ill person who was dying and made this decision to sort of help make the distinction between medical aid and dying and suicide, which has such a huge stigma. And I think sort of infects the medical aid and dying conversation because people do think, I mean, they call it, ill-informed people call it assisted suicide and so on. So I don't want to underestimate the reckoning that takes in each person who's part of that process.
Did you have any help in that reckoning process? I mean, I'm curious what, you know, and maybe Leslie, if there's some things you want to add to that, as far as, you know, I'm thinking of a dear friend who's now in her 80s and just found out that a return of a cancer that at first the doctor said you may have less than 2 months to live, and now they think they might be able to manage it a little bit longer. But I'm hesitant. I don't know quite how to bring up the topic, how, you know, to say, how do you feel about this, where you'd actually have control over this? And I really would appreciate your thoughts, Julie and Tom, and also Leslie, on what I, as a, you know, as a concerned friend, is there a space for me to actually bring this up as a topic, or, you know, how would I do that?
Yeah, I'd love to hear Tom's thoughts on that. And my thought is just to say, are you aware of this option? That is really as far as I go in conversations with people, because so many Californians don't even know about California's end-of-life option. So I just open the door with awareness and then offer support to people who want to explore it. But I'd love to hear Tom and Leslie's response too.
Darn it, Binky. I would, you know, one way is, again, just raising the awareness. And part of that is, hey, I attended a seminar recently where I heard this topic and I want to learn more about it. And I want to tell you about it. And then just open the door without, you know, being pushy about it. Because as Julie says, lots of people don't know very much about it. And at this point, it's legal in 10 states, which is a far cry from just a few years ago, plus the Washington, D.C. So there's 11 jurisdictions where it's legal in the United States now, and that I hope will continue to grow. But I also, that's just my recommendation on one way of doing that. Just learn more about it for yourself and discuss it. Discuss with your friends, what you're thinking about for your future, you know, and open the door that way. I do want to, again, give kudos to Julie for mentioning the language aspect, because language is incredibly important in this. It really matters. It's not suicide. It's not physician-assisted suicide. It's medical aid in dying, or California End of Option Act, if you want to call it that. But, you know, and as she said, the cause of death on the death certificate is the primary illness. It's not the fact that somebody may have ingested drugs to ease their suffering. So that's something that, you know, even, you know, because if you do say, oh, you know, I went to the seminar and I'm thinking about this and when I might invoke it for myself, you know, if somebody comes back to you and says, oh, I don't believe in, you know, physician assisted suicide, then that's, you know, that's a quick a teachable moment, if you will, educational point to make that it isn't any of those things. So
Yeah. So Leslie, you want to add to that? Yeah, thank you.
Yeah, I'll just echo what Tom and Julie were saying, is that I think the most important thing is just raising awareness. And that's why we have our Access campaign, because like Julie mentioned, although this law has been in effect since 2016, there are a lot of people that are still unaware that it does exist. So I think just giving them that information is important. One tool that I think that I personally really like is the End of Life Decisions Guide, which we have on Compassionate Choices on our website. It really just helps you think through your priorities for end of life. So it has a lot of different tools, advanced directives, other resources that I gave a copy to my mom just because I was telling her, look, there's all this information just so you can be aware of what you would want at the end of your life. So I would say just giving them that information and then talking to them if they have any questions.
Yeah. Yeah.
And Lorraine, Lorraine,
Sure. Yeah, sure.
if I could just add, I think we intimated at it when we talked, like Medicare doesn't cover this, the VA doesn't cover it, those sorts of things. But if you find you're in that situation, I would still do what I could to learn about what the options are, what the process is, and Compassionate Choices. The references that Leslie just mentioned are excellent in helping learn about what the choices are. And I'd say come up with your own plan B. If your medical provider won't support you in this, try to change medical providers. If you can't for whatever reason, come up with your own plan B, make sure your advanced directives are, complete and specific as to what your desires are. And I would say, advise your medical director, if you can't change, that you want to be entered into hospice as soon as you are eligible. Too many physicians still do not refer to hospice until the final days, or maybe 2-3 weeks. It kind of is a disservice to people because hospice offers so much. So I would say, I would tell my physician, I want to be apprised as soon as you think I might, as soon as your accurate diagnosis, not what you think I want to hear, or prognosis, is that I might have 6 months or less to live. And then you have that, you can also, I'm sorry, let me get, something keeps popping up on my screen. Then you can add that to your tool bag, and you can decide, that if this is something you might want to proceed with, you can enter hospice. Again, they can advise on which hospices are supportive. And if you're with a hospice that isn't supportive, you have the right as a patient to change hospices at any time. And so I would just say, if you're stuck in that situation, ask to be apprised as soon as possible as to when you might qualify for hospice care. And that's what I would call your own plan B. Learn what you can and get into hospice as soon as you can with a supportive hospice.
Thank you, Tom. We've had a few questions added into the chat, some of which have already been answered. So folks, before we turn it over for everyone to, I'll put you on gallery and you can raise your hand that way. One of the questions I think really needs to be answered, and I'm not sure if this is a Leslie question, probably is. Richard had asked, is there, well, and Richard and Ruth had asked the same thing, is there financial assistance available locally for people who want to use the option but just don't have the money? And that's one question in that realm of money. And the other one is, if someone's health insurance is federal, what are the options? That's very important, I think. And then there's the question of, if I needed to find 2 physicians that will help me with this, how would I find them? So sort of in the money angle, and then and how to go about it. And I just want to ask, just mention that I put it in the first thing in the chat. I put a PDF of resources that Leslie had provided, just a whole bunch of active, links and things like that, as well as some good videos and what have you that are all there in that PDF. So if you want to take and copy that, please do. Anyway, Leslie, please help us with these questions.
Yeah, as far as insurance, like Tom mentioned, it's not covered by Medicare, but Medi-Cal and some private insurances will cover a portion of the cost. And like Tom mentioned, the costs aren't as high as they used to be, but you can get help that way. And just to touch on getting a physician to support you. So you can ask your physician to refer you to another provider. And we also have, and I can put the number in the chat box, but we have our end of life consultation program. So they can help you and give you information about other facilities that allow physicians to support patients in end of life care options. And we also have our Find Care Toolkit on our website, where you can find healthcare systems and hospices that are supported.
Yeah, I also want to make a plug for Compassion and Choices has a great doctor-to-doctor program. So if your doctor has questions about California's end-of-life option, they can connect with another physician to talk through those questions. So that's another great resource.
Yeah, and that is, they can talk confidentially to each other using doctor speak, right? But, and when we talk about supportive hospices, I just want to make this clear. Hospices may be supportive, but since most hospice funding is Medicare funded, hospice will not provide they may prescribe the medications, but they won't fund the medications because it's illegal for them to do so if they're using Medicare reimbursement. But as mentioned, it's not as prohibitive as it used to be. I'm not aware of any local sources that somebody could, hit up for it. And maybe you have a couple of friends that would chip in. If they're supportive enough, then that might be an option for somebody.
Be interesting.
I just wanted to mention too about finding doctors that are supportive of the law. It's helpful to get pretty granular with your doctor about not just would you support me in the end of life option, but would you be willing to write the prescription for the end of life option? Because my dad actually, the day of his diagnosis, his primary physician said, yes, I'll support you, because we didn't ask the question specifically enough. So he said, sure, I'll support you, but then ended up abandoning my dad in partway through the process because he didn't want to write the prescription. And the law in California is that doctors are not required to participate in the law. They can opt out of participating or supporting it. So just make sure to ask a pretty granular question of your medical provider.
Good one. So at this point, do we have any other, I'm going to switch over to gallery so I can see you. Do we have any other questions or comments anybody wants to throw in? So far? My goodness. Oh, yes, Tom Moore. Go ahead, Tom. Unmute yourself. Thanks.
It's good to see Tom's face again. Tom and I haven't seen each other face to face in probably 10 years, something like that. Yeah. Thank you for presenting this today.
Thank you.
Yeah. Any other thoughts from anybody? Ruth, go ahead.
Yeah. I understand that people have to be mentally competent to be able to use the end of life options. But is there any move to change this for people who are right at the beginning of an Alzheimer's diagnosis? I have a friend, had a friend who was diagnosed and very shortly afterwards made the decision that she did not want to live with the deterioration that this disease brings. And so she killed herself very brutally. And I'm just wondering if, as the law changes, if there's going to be any change in that direction.
I can answer that. I've done a lot of research on this topic, and unfortunately, no, the law is not going to change to address people's in Alzheimer's or dementia. That said, the Compassion and Choices website has a great list of all of the end of life options, which include, for example, VSED, which is to stop eating and drinking. So there are other options for people who have who are struggling with mental competence, but medical aid in dying, I think, is going to be strictly for people who are deemed mentally competent.
And we're seeing more resources being added in the chat. So folks, if you just have to basically click on the chat and you can save it to your desktops, you'll be able to get those resources pretty easily and see everybody's questions and comments, which would be nice. But thank you so much. I mean, between Julie and Tom and Leslie's sharing, are there any other questions about for Leslie or others related to the law and what we have going on right now in California? And perhaps maybe this is a plug, if we're supportive of this, that we can, Leslie can share with us how we might be able to help with our legislators to at least support the changes that need to be made to this law. Leslie?
Yeah, I can actually put in the chat, and Lorraine, I can send you this, but yeah, if you can sign on as an individual endorser of SB 380. You can also, if you know any organizations or you're part of an organization, we can have them as an organizational endorsement as well. So I can send a link to that. And yeah, just calling your representatives and letting them know that SB 380, making sure that we keep and improve the End of Life Option Act is important to you. Just getting those calls, it can help sway legislators, giving that personal touch, personal story, makes a big impact. And, you know, we're still working hard to make sure that we get the votes and we get this law passed. So if you can support us in any way, we'd be really appreciative.
Would it be helpful if we contacted our local state assembly and senators at this point, letting them know, give them a call or what have you?
Yeah, and we actually have a link in on our website where you can either give them a call or send them an email and let them know.
Awesome. Awesome. Thank you so much. Well, we are coming upon the 11 o'clock hour. And again, I want to thank our speakers today for really bringing us to a real heart-to-heart talk from personal experience about medical aid in dying. And I want to segue and just make a little announcement before we conclude about PALS next seminar, which will be on Saturday, June 26th. And the topic is Journey Together with Dementia, Exploring Care and Supportive Services, which would be probably all helpful for all of us to take a look at. So watch your inboxes for notification about that and an ability to register for that, and maybe mark your calendars now for the Saturday, June 26th from 10 a.m. to 11 a.m. And thank you all for joining us on a Saturday morning, and hope your day is full of fun and laughter and maybe seeing people face to face. Thank you.
Thank you.
So long, thank you.
Thanks.